Hello, everyone. My name is Hannah Poulton, and I'm the Clinical Director of HLP Therapy and the Positive C-Section Company. And today I'm talking with an amazing midwife who also specialises in wound care. And I'm going to let Shana introduce herself to you. So over to you, Shana.
Hello, thank you for the call. Thanks. It was I literally set up my little Instagram account yesterday, and I've already managed to meet Hannah and her amazing service. So it's nice to meet you. So I'm a midwife. I've shown I'm a midwife in Ireland, and I work in a very busy obstetric hospital. So we see a lot of people with, I think maybe a third of our clients have C-sections, which is kind of the general rate in Ireland anyway at the moment. I think it's 27%. No, it's 34%, I beg your pardon, as of this year. So it's super common, a very super common operation, but then afterwards, you know, the care can be a little bit haphazard. I mean, for most people, they're very well, healthy people. So that, you know, you have a wound and your body wants to heal the wound and it will heal the wound. But if there are complications, you know, it can be very, very difficult, very challenging with a newborn and everything. And so for me, I work in a department that sees high risk people, antenatal and postnatal.
Right.
So the postnatal people that came back with problems were people generally with wound problems.
Yes.
And I just found that the expertise, it might be there one day with a certain doctor on call, it might be not there the next day. You know, you're in the position of maybe if there's no tissue viability specialist in the hospital, the maternity hospital, it might be in a general hospital, you know. So that drove me into this line of study. So what I did is I went back and did a diploma in wound management and tissue viability, and I'm doing my master's at the moment, right now. Just studying, Hannah, right now.
Oh God! Yes,
Thank you for the distractions.
Yes, well done. Well done. So you seem a very busy lady, Shana, at the moment. Just one or two things going on.
Yeah, just full-time work and motherhood and the masters and my cat. Oh, and this, yeah, because I thought I needed something extra.
Exactly. Why not? Why not?
The aim with just setting up the account is, you know, I'm not going into business or doing anything as such at the moment. What I'm doing is just I wanted to create, or I had created, a little document to educate people postnatally as to what to expect from their wound, and then how to spot any complications and what those complications are. Because I think you know, among healthcare professionals as well as postnatal people, you go back with a wound complication and you're generally given antibiotics and told it's an infection and that's it, you know, like deal with it. But there's a lot of different things that can go on with wounds, and I think that knowledge is power. And you know, there's a reluctance to overload people with information postnatally, you know, like generally you don't want to give out too much information because it's like this might not happen. So I feel for that reason it's not there. It's not anywhere. Is it anywhere, Hannah? Have you found it anywhere?
No. Well, this is what we were talking about, isn't it? The fact that, well, it seems that postnatal care is not as great as it could be. We're not here to be poo-pooing anyone's practice or the NHS or, you know, how everything's going. But postnatal care needs to be improved, especially after C-sections. And I know myself in clinics, I'm seeing mums that are coming through that are more traumatized in terms of their C-section birth and how they've recovered and how their scar has healed. But also unanimously, everyone is saying there is not that care to know what to look out for with your scars after you've had a C-section. And like we've said, all the focus is on the baby, and so it should do for a greater extent. Yes, you've got a brand new life. However, the mum does seem to be getting a little bit lost in the process. And so this is why I was so pleased that you agreed to chat with me today. Could we just then talk about so after a mum has had a C-section, what are the simple things that she can do to look out for her C-section to check that it's not infected?
Right. Well, I suppose the first thing is to know what's normal and what's not normal as such for a surgical wound. So a surgical wound, it's a straight cut, so it heals with the two edges together like so. So it's called healing by primary intention. So that means that what happens first during the first 2 to 3 days is that the very top layer of skin forms across the top to form a barrier. So it's funny because, when people then, your midwife or whoever looks at your wound after 2 to 3 days, they maybe take off that dressing and they go, great, that's healed. Now, healed is it's a funny term because in wound healing, so if you have an open wound, it heals from the bottom up, what's called secondary intention. The granulation tissue fills in and then the top layer fills over the top. And that is healed, that's the process of healing. But with a surgical wound, if you look at it and go, yeah, that last part, that epithelialization the skin formation has happened, so it's healed. It hasn't really, because there's all these other layers in underneath that are still, doing their thing. So, I suppose that's the first thing. It's normal after 2 to 3 days for the top layer to have formed, but underneath the granulation tissue is filling in, so and all those other layers are coming together. So the healing is continuing. So you need to just keep an eye on that wound and be gentle with that wound for a number of weeks afterwards. No tight fitting clothes rubbing into it, anything like that. Cover it with a wound pad.
Yes.
So to look out for infection, infection can come in a couple of different ways. So it can come from the top into the wound. So that's the idea of the dressing for the first 2 to 3 days, is that it forms a sterile barrier because it's put on in surgery. So it forms a sterile barrier over the wound to stop any bacteria getting in from the environment or your hands or your skin or anything like that. And then when you take it off, it's only then if it's the top layer of skin has formed, and now that is the barrier. Yeah. Now, if that top layer of skin has not formed and hasn't made an effective barrier, really it should be cleaned and a new dressing applied. But again, that's not always done. And it's not really sitting in any guidelines, that's just common sense. But it's not out there, even the nice guidelines for cesarean section wounds, because they look at RCTs, like randomized control trials and things like that. They recommend 6 to 24 hours you can take that dressing off, which, we also just have to base guidelines on evidence. But I would say to a certain extent, you have to base wound care on what you know and what you know of the physiology and that as well. So, I beg your pardon, I haven't talked about infections at all, but
no, you see, Shauna, this is so interesting, and the purpose of this Zoom and chatting to one another is to showcase your knowledge, which is absolutely phenomenal, but also so that mums feel a bit more empowered. So what we're saying, mums, if you're listening to this, if you're planning for a C-section, or if you just want to know a little bit more about how your C-section can close and heal, then this is the purpose of this call with Shana, so she can tell you. So what we've just been talking about, if you've only just started watching, is just about how the wound closes, how you might have a dressing on, and how when we say, oh, it's healed, we're looking at the top layer, but of course the healing is still going on deep down. In C-sections, they go through 7 layers of your body, your skin, your fascia, your tissue. So of course, they've all got to heal. And this is why we say rest is so important, fluids are so important, gentle mobilization is so important, pat drying your scar after a shower using a soft cloth, muslin sheet, letting the air get to it after the dressing is off, just so you're helping, because where the C-section is, it's going to be warm, isn't it? It's going to be create moisture around that area because of where it is, and you'll possibly have a tummy over the top because you were pregnant. So all these things are super, super important. So Shana, can you tell us, if somebody has an infection, what would that look like? Yes, I know.
So really, you in the first couple of days after the C-section, you can feel pain along the incision site because it's an incision. And the first stages of wound healing really are, first to stop the bleeding, and then inflammation, where your body sends a lot of messages to that area and a lot of fluid to that area and white cells and everything to start the process of healing. So that inflammation in the first 3 to 4 days will cause pain around the site, and there'll be a little bit of oozing on that first dressing. But after that, the pain should ease off. And really, a sign of infection, or a major sign of infection, is increasing pain. So you shouldn't ignore pain. You should just be aware of your body and your needs for pain relief in the first few days, and then compare that with time as it goes on. So usually people after 3-4 days can just use paracetamol and maybe the odd ibuprofen, and their pain should be very well managed. So I would say, if there's a deep infection, so I was kind of trying to say about types of infection. One is that comes in from the top, but the other type, and specifically with cesarean section wounds, is one that comes from the bottom, because you have bacteria in your vaginal canal, you have bacteria, can be in your uterus at the time of the C-section, especially for people who have had an infection prior to delivery, or maybe that's the reason why they were delivered by C-section. And those bacteria can get into the deep tissues, or, there can be a breach in the surgical procedure as well, and the sterility of the surgical procedure, can happen in any surgery. The bacteria can get into the deep tissues.
Yes.
And the infection can happen from the inside up as well. So that's why I always say to people to watch out for pain, because you might not see anything on the outside, but the pain can be increasing as the bacteria are growing inside. Now, that's not to frighten people, because, pain that comes and goes is okay. I mean, okay, in inverted commas, like post-surgically, you'll feel pain, Like, I don't know if you come across people that particularly have this, like, stitch pain on one side. Like a deep fascial pain, where that knot is tied on one side. And that is normal. As such, it's not great, it's something that hopefully maybe somebody like you can deal with. But for us, we can say, okay, this comes and goes. It's when you stand up maybe and you sit down, it's not there all the time and growing. So for us, it's normal. Off you go. And then somebody like you, hopefully, is going to help them long-term deal with that type of pain, But anyway, so pain is a major sign of infection. Then superficial to the wound, if you start seeing redness, growing redness, the cellulitis is a skin infection. So, and that is a redness that grows up and up and up the abdomen. You need to immediately, get back to the hospital or the doctor for antibiotics for that. If your wound separates, and especially pus is coming out of that wound, it's absolutely infected. But you will in that case as well see redness and irritation, heat, pain around the area, So anything, if you think about a cut on your finger, and it's a cut on your finger, it's a little bit sore, but then it starts healing over. If that cut gets infected, it really, gets bigger and throbs, and that's similar, your wound, okay, it's not comfortable at the start, but it's getting better. It shouldn't get worse and start throbbing and be really painful or oozing or red or swollen.
No, that's, thank you so much. That's really good. And like you said, this isn't to scare mums if you're watching this. This is just to give information. And of course, if you're worried, then you chat with your midwife, your health visitor, your GP. And
never be afraid to come back.
Exactly, yes. Exactly, yes. And don't be afraid to stand up and ask the questions. This is your body. We want to empower you to have the best recovery possible. So yes, and try not to, lose yourself in all the chaos that surrounds you after you've had a newborn baby. I've had a C-section myself, so I'm speaking from personal experience there. Yes, as well as a vaginal birth as well. So yes. When I do speak to mums, I do speak with 20 years professional experience, but also on a personal level as well.
Fabulous. Was that a VBAC, Hannah?
No, I had my
the other way around.
Yes, birth first, and then opted for a C-section because I had lots of complications. So I really like, a bit like you, Shana, to use the platform that any social media offers just to empower women and to give them the knowledge. And I think that's really important.
And diet, Hannah, I know you were talking about rest and minding yourself and keeping the wound dry once the dressing is off.
Yes.
But diet, I mean, the wound, we can do anything as healthcare, like, in the hospital, we can, put anything on top of a wound, but
Yes.
basically the wound will only heal from the inside out. So it's only
Yes.
the person themselves who can heal their wound. So, you do need a really good, varied diet to heal
Yeah.
your wound. And the better your diet is, the faster your wound will heal. So many people lose so much blood during surgery. Even a regular amount of blood, like 500 ml blood loss, can drop your iron levels considerably. So I think for most people to consider an iron supplement even every second day, not to a level that's going to constipate you, because you don't want that postnatal either. But ask on discharge, what's your iron level, and would you benefit by an iron supplement? Your hemoglobin is what carries oxygen around your body, and that's what helps your tissues to heal as well, and to avoid things that stop the oxygen to your body, like being around smoking and that kind of thing as well. Protein for wound healing is so important. If you remember nothing else.
I always say exactly the same. Yes, those building blocks of cellular recovery. Yes, so important. So what foods do you recommend mums to have then after they've had their C-section birth?
Well, I usually give them the dietitian's leaflet.
Oh, really? Fantastic. That sounds good.
Yeah, and and ask them themselves how their diet is, because it's all very well loading a whole load of information on people and saying have this and have this, have this, but we really have to look at where somebody's diet is right now, and what tweaks they can reasonably make to their diet to make it better. Do you know what I mean? Like, I could tell you to have tempeh and whatever chickpeas, but if you eat McDonald's every day, that's not going to be feasible for you. You know what I mean? So it's really about kind of working with people where they are.
Definitely. And I always say to my mums in my clinic, there's no judgment here at all. You eat what you need to eat to survive and what you have access to, definitely. But if you can start substituting things, try and get a bit of oily fish in your diet, try and get a bit of salmon, a bit of tuna, a bit of mackerel, try and see if you can bump up on that protein, whatever that looks like to you. If you don't eat meat, then try and get those pulses and lentils, vegetables, nuts into your diet to deliver that protein as well. And also...
what I always ask people is, who's cooking for you?
Yes, exactly. Exactly.
Because, you shouldn't have to be in the position of cooking for yourself, postnatally. You've enough to be doing, honestly. And you need to recruit the help of people who are going to drop you in meals, or like vouchers for food to be delivered, or people do want to help postnatally. You just need to direct them into ways that they can help you absolutely practically.
And after any birth, you need that help, don't you? But especially after a C-section, because of course you are recovering from a surgical birth. So you need that support, carrying, your baby, moving things, getting on and off the toilet, getting up and down stairs. All those things can be really quite tricky. So yes, whatever help that you have, that if you're listening, whatever help that's around you, neighbours, friends, family members, your partner, in-laws, try and get them round and give them jobs to do so they can really help you. And don't worry about the cleaning and the washing. Get somebody else to do that, and focus on you and your wonderful new baby, especially. So yes, Shana, thank you so much for talking to me. You're an absolutely wealth of knowledge. And also on your Instagram, you have said you've written out a stage-by-stage process of what to look out for, haven't you? And your wound healing. So people in my courses, I'll be delivering a copy to you, so you'll have a copy there already. But if you're watching this live on my social medias, then please contact Shauna. Just tell me what your name is on Instagram.
I just had to think for a second, because I was like, okay. I've grabbed Wound Care Midwife. So it's woundcaremidwife@gmail.com and @woundcaremidwife.
Absolutely.
Do you know what I'm doing for my thesis, for my master's?
Tell me.
Not about wound care, but it is about wound care, and this is very important to me as well. It's about preventing problems. So I'm looking at methods to prevent surgical site infections happening. So what we can do in the hospitals, what we can
Yes.
implement to prevent any issues, to reduce those issues as well. And then afterwards, education and all that is part of it. But
yes,
we have to do our part, and then you can do your part, and we're all a big team together.
exactly. Absolutely supporting one another with the patient, yes, or the client, right at the heart of everything we do. That's exactly why I started, yes, HLP therapy.
It's fabulous, Hannah, because I always recommend to people to massage their scars, to release adhesions afterwards. And it's just so great to see that there's professionals out there also doing that.
Yes.
And recommending them. So and doing other techniques as well. I think your magic is being worked in the world.
Well, yes, we can do with what we can do, definitely. Shauna, thank you so much. I hope that this video empowers people that are watching it, healthcare professionals watching it. You've now got more information to tell your clients.
Oh my goodness, just contact me with any questions.
Yeah, that's absolutely fantastic. Thank you so much, Shauna. Thank you.
Bye, Hannah. Thank you so much. Nice to meet you.
Bye-bye.
Bye.